You went to the emergency room and an injection in your glute caused intense pain. You started limping after that injection and now you're wondering if it hit your sciatic nerve? So stay with this video until the end, because that's exactly what we're going to talk about now. Guys, there is a correct technique for intramuscular injections in the gluteal region. Why? Because the sciatic nerve runs through a certain area in the glute, and if you give the injection at that spot, your chances of hitting the nerve are much higher. Therefore, if a professional is not qualified or is inexperienced and does not perform the technique correctly, they might inject the medication directly into your nerve. Thinner people and children who have less muscle and less fat are the patients at greater risk of sciatic nerve injury during an injection. If you experience pain that radiates down your leg or intense tingling in the area after the injection, it could be a symptom of this problem. Especially if at the moment the healthcare professional injected the medication, you felt a strong shock going down your leg, you should also be alert. If you feel numbness, shocks, and continuous pain throughout your leg that gets worse over the days, unfortunately, you may have suffered from this problem. How can you tell if the nerve was injured? In addition to the symptoms we just discussed, tests to determine if the nerve was affected are extremely important. One of them is electromyography, which is a test that delivers small shocks to the sciatic nerve area to identify whether there has been any nerve injury, such as loss of movement strength, muscle weakness, or even loss of sensation. In addition, an MRI of the gluteal region with sciatic nerve neurography can reveal changes in the area where the medication was injected. So I had this symptom, I did the tests, and I identified the injury. What is the treatment for a sciatic nerve that was injured by an injection? First of all, seek out a specialist who works in this area. They will run the tests, identify the problem, make the diagnosis, and will be able to help you with this. Among the treatment options, we have conservative and surgical approaches. First, conservative treatment is extremely important. With it, we can start medications to control neuropathic pain, such as gabapentin, pregabalin, or amitriptyline. In addition, physical therapy is essential. The use of TENS, FS, and even desensitization treatments are very important. Furthermore, myofascial release in the area where the nerve was injured can also help. And the use of orthotics and foot movements so that you can gain strength and avoid foot drop. This applies in cases where the injection has affected the muscles too much. If your case involves a significant loss of sensation, pain that does not improve with medication, or even after undergoing physical therapy your injury does not improve, then surgery is indicated. Normally, we wait between 3 to 6 months before deciding whether or not to perform the procedure. The procedure is carried out by a specialist in the area of peripheral nerves, and what is done is either a decompression of the nerve or even a reconstruction, in case it is a more serious problem. For patients who have a significant loss of strength, we can also perform a tendon transfer to lift the foot so the patient does not end up with foot drop. Are you going through this? Did you get an injection, experience intense pain, and lose strength in your foot? Tell me your story. I want to hear about it. If you want more information about sciatic nerve injuries, like this video and follow our channel.